Hello, my name is AWieland. I'm a registered nurse and a student at the College of St. Scholastica. I'm in my second semester of the BSN to DNP program. One of the classes I'm taking right now is Foundation of Health Informatics. And throughout this course, I've learned some valuable information about the history, development, and use of health information technology in healthcare. Today, we're going to take a look at eHealth Exchange and how this technology can benefit organizations and patients on both an individual and community level. So before we talk about eHealth Exchange, just wanted to touch on a few key pieces of history of HIT and the development over the years. So the big push began in 2009 when the Health Information Technology for Economic and Clinical Health Act, or the HITECH Act, was initiated. This was part of the American Recovery and Reinvestment Act, was signed by President Obama, and it was meant to encourage organizations to implement electronic health records. The HITECH Act offered incentive payments to healthcare organizations whose use of EHRs and related health IT systems met predefined criteria and reporting requirements. So they set up 5 goals for meaningful use with EHR. In 2011, the Office of National Coordinator for Health Information Technology started working with regional extension centers to help healthcare providers transition to EHRs. They developed 3 stages to assist organizations in achieving meaningful use. And in 2018, they renamed the incentives program, increased the focus on sharing information between systems, wanted to make it easier for patients to access health information, and the goal was to enhance electronic reporting to public health and improve patient care. So what is eHealth Exchange? eHealth Exchange is described by Nakashima and Odom-Bell as a network of networks. So it started in 2006 as a federal program initiative under the Office of National Coordinator for Health IT. Today, it's one of the largest nationwide health data sharing networks in the US. They share clinical information securely over the internet, and they use a standardized approach to do this. And one of the most invaluable aspects is that they facilitate data exchange with 4 federal organizations, including the Veterans Health Administration, the Department of Defense, Social Security Administration, and Indian Health Services. And if any of you have ever had experience trying to get records or information from the VA clinic, you understand how truly valuable that alone is. In 2012, eHealth Exchange became an independent nonprofit health information network, and they continue to grow rapidly. There's 75% of all hospitals in the country using it, 70,000 medical groups, and over 120 million patients. What are the benefits of using eHealth Exchange? Some of the main benefits here are monitoring disease and condition trends, managing outbreaks, and communicating back to providers about the outbreaks, and helping them develop protocols. So there's really, it helps in a lot of different areas. How can eHealth Exchange improve health equity? Monitoring trends in underserved and rural areas can assist in development for more appropriate interventions that are specific to that community. Managing outbreaks in communities improves disparities by identifying where additional resources are needed, and communicating between providers can decrease healthcare costs by reducing unnecessary duplicate testing, making it more likely for lower income families to get medical care when they need it. let's just take a quick look at a real life example of how eHealth Exchange can be used with the COVID-19 tracking. So receiving the reported COVID-19 tests and diagnosis in real time can allow for public health agencies to better track and report positive infections and pinpoint areas with high or faster growing positive infection rates, and getting treatment and resources out there to where they need to be. And just a couple of personal experiences that I have noted in the last few weeks when I've been working out in the field, where eHealth Exchange could have benefited patients that I was taking care of. So the first one was in a home care setting. I was there for a weekly med setup. The patient normally doctors through the VA clinic, but had seen a specialist here at a local clinic. I went to set up his medications, and a new medication was ordered by the specialist, but he did not have this medication in his home. So I called the VA clinic, the pharmacy, and they reported that it takes 4 to 6 weeks to fill and send out a medication that has been ordered by an outside provider. And that just created extra work, really. We had to get the medication filled at a local pharmacy. It was an extra cost to the patient. If he gets medications filled at the VA clinic, it's of no cost to him. So he had to pay for that 30-day supply, and that was quite inconvenient for him. So that's just one example. Another example, in an ambulatory care setting, working with specialty providers like the cardiology team. They often see patients from different systems. There have been times when we've had patients who have seen a cardiologist in a different state before they moved to Minnesota, or when we have snowbirds, so when they go to Florida or Arizona, they maybe have a cardiac emergency and see a cardiologist there. And we just don't have those records that we need. We can get records faxed, but they might not contain all the information that we need. It takes time to get those scanned in, because that has to be done by a specific department through our organization. And sometimes those records are just hard to read when they come in faxed, and it's difficult to see the information that we need to take care of the patient. Sometimes things like an echocardiogram, the report might be there, but the images aren't, and that's important for the providers to see as well. Really, it results in unnecessary duplicate testing or delay in accurate treatment and diagnosis. Sharing information with eHealth Exchange. So it's important to note that eHealth Exchange does not store health care data. It is just a secure agent for exchanging information among its participants. There's active participants in all 50 states, including the federal participants, and Data Use Reciprocal Support Agreement, or DURSA, allows participants to agree to one set of legal trust documents in order to be able to exchange data with all other participants. So before they can be a part of eHealth Exchange, they must agree to these legal standards that have been set to ensure that everybody has the same understanding of how this information is shared and who it's shared with. There's opt-in and opt-out. Some states have laws that require either opt-in or opt-out model. Other states leave it up to the provider or healthcare organization to determine that consent process. So it's really that aspect is more individualized. There is a set of standards or legal rights and obligations and a governance framework that sets the groundwork for participants to securely share the health data, like we talked about earlier. And eHealth Exchange must protect data it receives or transmits that constitute protective health information, or PHI, under the provisions of the HIPAA privacy. So any information that's shared, it comes to eHealth Exchange from one provider, they send it to the next. They do not keep this information. It is not stored anywhere in their database. They have they keep records of the transactions made, but not of the information that's being shared. And that's just important to note that as a patient, so that you understand that your personal health information is safe and secure, only being shared between the providers and is not shared with any middleman. And reporting to Medicare quality improvement organizations or healthcare plans, that can be done through the eHealth Exchange Hub. And as part of the merit-based incentive payment systems, or MIPS, the eHealth Exchange participants can fulfill certain criteria when they share health information bidirectionally. They can, beginning in October of 2021, hospitals can earn additional points by implementing the 4 public health and clinical data exchange measures, including electronic case reporting notifications. So eHealth Exchange does help get these organizations to meet the meaningful use and get their incentives met. And last but not least, just to summarize, eHealth Exchange is a secure way to transfer and share information between healthcare organizations. It improves patient outcomes by ensuring timely communication and shared treatment plans. It is cost effective and can reduce unnecessary duplicate testing. And it has active participants in all 50 states, which can improve clinical decision-making and improve patient safety. And here is a list of references that I used to develop this slideshow. So thank you for your time.